We don't think that there is a fifth outcome here. And we think that broadly, any chain of events that South Africa will now experience will fall somewhat. You'll shoehorn it into the confines of one of the three scenarios that have survived our initial assessment. Give you a little bit more detail on the numbers that we're starting to produce out of each scenario. There's viral containment. It was the top right quadrant. Viral obliteration, bottom left. And then viral firefighting was top left. In terms of duration, viral containment, 18 to 24 months, because the vaccine is necessary to bring it to an end. And we will learn to operate within the confines of the economy, will learn to operate within the confines of isolation to a far greater extent than now appears to be the case. Viral obliteration, 3 to 4 months, given the herd immunity outcome. Firefighting as short as 6 months, given the seasonal effect, and as long as 18 months, given the early availability of a virus. You might also make that one 6 to 12 months. The effect on people, we try to measure that in terms of work. Initially, we think the case now is that in the region of between 7 and 10 million, think of them this way, 7 to 10 million people who a month ago were reasonably confident of getting an income are probably now in a position where they would not be confident anymore that that income, the full extent of it, will be available to them in the weeks and months ahead. In viral containment, we start with that number, a consequence of the present shutdown, and that sees the unemployment rate spike to 40% plus, and that figure will then taper downwards as protocols are put in place that allow more sectors to begin operating again within the confines of reasonable measures of containment. Viral obliteration, we start with that same number of people, and the costs to society will see the unemployment spike to 50% plus. Now, note that we have not put a ceiling on that number. You start with the same numbers of people, but after national level, but more on a regional or geographic or sectoral level. And again, the risk is that our unemployment figure might escalate to a quite extraordinary extent. Economic growth, containment, we could get away with. We are in recession under all these outcomes. Under containment, if it's well done and a fair amount of activity is back, economic activity, we might get away with an economic contraction as limited as -2%, but it could be as broad as -5%, we think, depending on global factors. Remember, South Africa is a very small ship, a boat, in fact, a raft, as some might say, afloat in a very big and tempestuous sea. We account for less than 0.5 percentage point of global GDP. And then also here, the speed to which we can taper people back into work and the efficacy of what a rescue, fiscal, other measures might be introduced by private sector players and the South African government. Viral obliteration, we're looking at a very deep recession. And in my conversations with some economists that I hold in high regard over recent days, there is a view that -7% number might be optimistic, and hence it has a plus on it. And again, no ceiling. And firefighting, you're looking at very, very deep contractions again for the duration of the pandemic. Then of course, setting up the long-term era of recovery. In terms of the healthcare effects, containment, 30 to 60% of people infected, of which below 1% of that number will die. And the reason why we're at the lower end of the estimate there is that the curve will have been sufficiently blunted and enough time will have been bought in this initial 21-day shutdown for healthcare providers, public and private, to be geared to treating the proportion of people who become ill. Viral obliteration, the worst case outcome materializes, and firefighting, we put the figures between the two. The internal political stability of the country remains good under viral containment because sufficient economic
Dr. Cronje, I do apologize. Can I just pause for a moment? I'm just going to mute all participants and ask you to unmute yourself thereafter.
Right. Have you got me back again?
Indeed.
Very good. Internal stability, political stability of viral containment, good. There's the economic cost is not as severe as we'd feared, and hence, which is always the great driver. It has been the case in our analysis for decades of internal instability in the country. Viral obliteration, you must experience a sharp deterioration in internal instability. And on the back here of some numbers we have worked on the past decade that already show a very sharp escalations in levels of violent protest action in the country. And I might go a little bit further here and say, given insights developed out of polling we conducted around the 2019 election, I don't think it is too far-fetched to say that the consequences of viral obliteration, healthcare will be devastating, the economy devastating, but it might be sufficient of an inflection point to later trigger political changes in South Africa on a scale of what the country last experienced in the 1980s and 1990s, and viral firefighting high volatility. On the question of the end events, the vaccine is the end event for containment, herd immunity for obliteration, and the firefighting, the end event is the early vaccine or a seasonal effect or a mutation. And that is my contribution for this morning. Herman, I thank you for introducing me and for chairing. I stay in the background of this meeting and hand over now to some of my colleagues on policy, but I will be available to take your questions towards the end of this briefing and also beyond that if further questions arise. Thank you very much.